If you're 55 or older and at least once, maybe late at night when the house is quiet and the internet feels louder than your own thoughts, you've caught yourself wondering, if I masturbate every day, am I damaging my prostate? Am I causing inflammation? Am I increasing my risk of cancer? Then you are far from alone. That fear doesn't come from your body. It comes from years of myths, half-truths, and alarming claims repeated online without context, without nuance, and without medical responsibility. Most men don't talk about this openly. Instead, they carry the question silently, comparing forum posts, dramatic headlines, and secondhand stories with subtle changes they notice in their own bodies. Changes that rarely arrive suddenly, but instead creep in slowly. A night wake-up here, a weaker urine stream there, a sense that things don't work quite the way they used to. Before we go any further, let me ask you something simple. Have you ever had this concern? If yes, write yes. If it comes and goes, write sometimes. Not for details, not for explanations, just so other men can see they're not alone, and so we can talk about men's health the way it deserves to be discussed, calmly, honestly, and based on real science. My name is Dr. Laura Miller. I'm a physician, and I've worked in men's health for over 10 years. During that time, I've seen the same pattern again and again. Men who are disciplined, intelligent, and capable, men who solve complex problems at work and take responsibility for their families, suddenly feel uncertainty and even shame when the conversation turns to the prostate, sexual function, or basic physiology. And that's exactly why today we're addressing a question that often sounds louder than any medical advice online: what actually happens to the prostate when ejaculation is frequent, including masturbation, and whether a daily habit is truly harmful. To move past fear, we have to start with physiology. The prostate is a small gland, often compared in size to a walnut, but its importance far outweighs its size. It produces fluid that contributes to semen and plays a direct role in fertility. Just as importantly, it sits directly below the bladder and surrounds part of the urethra, which means it has a major influence on urination. Because of this location, even small changes in prostate tissue can affect how a man urinates. That's why symptoms like frequent nighttime urination, weak stream, hesitancy, or incomplete emptying are often associated with prostate changes. As men age, the prostate changes. This is normal biology, not failure. Tissue composition shifts, hormonal signaling changes, blood flow patterns evolve. None of this automatically means disease. But this is exactly the stage of life where fear-based explanations tend to take over. Claims start circulating that sexual activity wears out the prostate, that masturbation causes chronic inflammation, that frequent ejaculation somehow irritates the gland and raises cancer risk. These statements sound convincing until they're examined scientifically. In large, long-term observational studies that followed tens of thousands of men over many years, researchers tracked lifestyle factors, medical outcomes, and, among other variables, ejaculation frequency. And what they found directly challenged the common narrative. Men who reported more frequent ejaculation tended to have a lower risk of being diagnosed with prostate cancer, particularly less aggressive forms. When researchers compared men with relatively low frequency, roughly 4 to 7 times per month, to men with higher frequency, around 21 times per month or more, many analyses showed a consistent reduction in risk. The exact percentages vary depending on methodology and adjustments, but the direction of the association remains stable. In other words, frequent ejaculation does not appear to damage the prostate. Now, this does not mean ejaculation is a treatment, and it does not mean more is always better. What it means is that the simplistic idea of using up or overworking the prostate through sexual activity is not supported by evidence. Why might this association exist? There is no single explanation, but several biologically plausible mechanisms have been proposed. One theory involves reduced stagnation of prostatic fluid. Regular ejaculation may help clear secretions that would otherwise remain in the gland for extended periods. Another theory relates to tissue dynamics. Organs that remain physiologically active may maintain healthier cellular turnover patterns compared to tissues in prolonged states of inactivity or congestion. A third hypothesis considers systemic factors. Chronic stress, poor sleep, and low physical activity increase inflammation and impair circulation, all of which affect prostate health. Sexual activity, for many men, is associated with stress reduction, improved sleep, and better overall vascular function. But here is the most important medical clarification I need to make. Correlation is not causation. These studies do not prove that ejaculation prevents prostate cancer. What they suggest is that ejaculation frequency may reflect broader aspects of health. Men who maintain sexual function later in life often also maintain better blood flow, healthier metabolism, greater physical activity, and more engagement with healthcare. That distinction matters, especially for men watching this video, because they are already experiencing symptoms. If you're dealing with frequent nighttime urination, weak stream, incomplete emptying, urgency, or pelvic discomfort, it's critical to understand that neither masturbation nor abstinence is a medical treatment. Persistent or worsening symptoms should always prompt proper evaluation. These symptoms can be related to benign prostate enlargement, inflammation, vascular changes, nerve signaling, metabolic factors, or medication effects. Guessing or adjusting sexual habits alone is not a substitute for diagnosis. At this point, I want to share something useful. I have a separate video that focuses specifically on 5 daily habits that support prostate health, especially after age 55. In that video, I break down practical, evidence-based behaviors that reduce strain on the prostate and support comfortable urination over time. I recommend watching it after this one because prostate health is shaped by habits built over years, not by one isolated behavior. When it comes to practical steps, consistency matters far more than extremes. A diet rich in whole foods, vegetables, and healthy fats helps regulate inflammation and metabolic health. Regular physical activity supports circulation, which directly affects both prostate and erectile function. Sleep and stress management are no longer optional luxuries after midlife. They are physiological necessities. I also recommend watching my video, Don't Drink Plain Water, where I explain why hydration alone is often not enough after 55, and how targeted nutrition can better support circulation and energy. In that video, I discuss 5 key nutritional components linked to vascular and prostate support, including beets and pomegranate, citrulline, pine bark extract, leafy greens and ginger, and hibiscus, cocoa, and cherries, always emphasizing that nutrition works as part of a system, not as a quick fix. Avoiding smoking, moderating alcohol intake, and staying consistent with medical checkups remain essential. No diet, exercise routine, supplement, or sexual habit replaces proper evaluation, especially if you're over 55 or have a family history of prostate disease. So let's return to the original question. Daily masturbation in most cases does not appear to be harmful to the prostate, despite what many myths suggest. Large studies show that more frequent ejaculation is associated with a lower risk of prostate cancer diagnosis. But this is not a guarantee, not a shield, and not a replacement for listening to your body. Healthy sexuality should be viewed as one part of a much larger picture, a picture that includes circulation, metabolism, movement, sleep, and preventive care. If you find value in this kind of evidence-based discussion, calm, respectful, and free from fear, please support the video by liking it, subscribing, and turning on notifications. And tell me in the comments, which men's health myth would you like me to address next? Prostate health? Testosterone? Sleep? Blood pressure? Blood sugar? Erectile function? Let's keep this conversation going, without shame, and with respect for the facts.